Namaskar dosto, good evening friends. I'm Dr. Sanjay Kalra, your friendly and familiar endocrinologist, and you're watching Dr. KK's Med Talks Mondays with Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 1009th एपिसोड है. Let's have the headlines for today. Now, according to the World Health Organization, about 14% of all adults above the age of 60, live with a mental disorder. And smoking impacts mental health significantly. Smoking का link anxiety, depression, cognitive impairment, stress और बाकी mental health disorders के साथ भी है. So maybe smoking prevents our ability to cope with stress. Stress तो ubiquitous है, life में होना ही होना है, but skin specialists say that stress can be the triggering factor for many skin problems also. तो यदि आप टेंशन में हैं, स्ट्रेस में हैं and you don't know how to cope with it, आपकी स्किन भी आग बबूला हो जाती है, स्किन के लीजन्स आ सकते हैं. Stress is also associated and mental health is associated with early life exposure to air and noise pollution. तो यदि air pollution है, noise pollution है, a 25-year-old study says that can also impact your mental health later on in life. And all this stress and mental health disorders, they are also linked to poor heart health. तो इसका मतलब ये इन सब हेडलाइन से स्ट्रेस और मेंटल हेल्थ का शरीर के हर हिस्से से लेना देना है. Stress and mental health are linked with each and every organ system of the body. So let's see what our topic is for today. ये हुई ना बात, coping with stress, how to cope. Instead of having headlines which just repeatedly talk about a problem statement, ये problem, वो problem, ये दिक्कत, वो दिक्कत, we now have a headline which talks about solution, and that's what India is all about. A very proactive Viksit Bharat. So our topic is coping with stress. And if you want a proactive topic like this, then you need a very proactive, youthful person to speak with us. So let's welcome our guest, Dr. Sarthak Kukreja. Warm welcome, sir.
Thank you, sir. Good evening, all.
Dr. Sarthak is a psychiatrist at the Department of Psychiatry in AIIMS, New Delhi, and he has studied at prestigious colleges like AIIMS Rishikesh and AIIMS New Delhi. And he's now advancing his expertise in this field. His main aim is to provide compassionate patient care, empathic patient care, and person-centered care to people across the country, and to serve the nation by improving our mental health. Thank you, sir, for being with us.
Thank you, sir. Thank you for having me here.
So we have people logged in from across the country. Ganesh Ambore जी आपको गुड इवनिंग कर रहे हैं. श्यामा चाइल्ड केयर सेंटर से गुड इवनिंग आपको आ रहा है. और एक क्वेश्चन आ रहा है डॉक्टर सार्थक, आपको भी स्ट्रेस होता है क्या?
Definitely, sir. Stress, तो as you said, is ubiquitous. सबको होता है, and it's a part and parcel of life.
And I think even if let us say you were to say कि मैं हिमालय पर्वत में चल जाऊँ, कृष्ण अरोड़ा जी ने लॉग इन किया है, सर सीनियर पर्सन है, तो मैं हिमालय पर्वत में चल जाऊँ और वहाँ पे स्ट्रेस नहीं होगा, ऐसा भी नहीं होने लगा. वहाँ पे भी स्ट्रेस आपका पीछा करेगी, कभी गर्मी, कभी ठंड, कभी पानी नहीं मिला, कभी भूचाल आ गया. So I mean something or the other will always be there. So the point is how to cope with stress. So Dr. Sarthak, over to you. How do we cope with stress?
Okay. So can I have my slides, please? So to start with, I think before going to coping with stress, it's important to understand what stress is, how do we define stress, and how does stress actually affect our lives. So stress as a term, we know कि बहुत मतलब हिस्ट्री में बहुत पहले से यूज हो रहा है टर्म, बट एक्चुअली इनिशियली जो रिसर्च एंड स्टडीज हो रहे थे तो स्ट्रेस का जो डेफिनेशन था दैट वाज प्रिडोमिनेंटली यूज्ड or rather borrowed from the concept of physics, जिसमें stress was considered as a force which causes some deformation. And the first time ये जब biological aspect में use किया तो it was used by someone named Hans Selye, who was actually an endocrinologist, and he did a lot of study on stress. And to understand the concept of stress, कि हम लोग usually what we do is we use the term stress with a negative connotation, but actually stress can be considered both positive and negative. जिसको positive stress को we call as eustress and negative stress को we call distress. And positive stress is something which is within our ability to cope, and it actually enhances our performance, whereas negative stress or distress is something which it is beyond our ability to cope, and it can decrease our overall performance. And again, stress can be because of the defined on the basis of the stimulus जो external pressure हम feel कर रहे हैं. It can also be understood as the body's response to a negative stimulus from outside and as a dynamic process. So just for the sake of definition, जो most commonly accepted definition is stress का, that it is a condition or feeling experienced when a person perceives that demands exceed the personal and social resources that the individual can mobilize. मतलब जितने हमारा capability है उससे ज़्यादा जब demand हो जाती है, that is what is called as stress. Then again, जो stressors होते हैं, stressors are around us everywhere, and they are all different types. Like we can have an acute stressor which can be time limited, जैसे a public speaking event like this one. Then there can be stressor sequences which follow life events, losing someone in the family or going through a divorce. Or there can be chronic intermittent stressors, like any student will have to go through when he has to go sit for exams every 3 months or 6 months. So that is a chronic stress, but it is intermittent. Then there can be chronic continuous stressors, like a marital discord or someone having a disability or a dependence in the family. And then stresses can be our daily hassles, traffic, transport, etc. And the sources of stresses can be everywhere. They are there in our everyday life, they are at our workplace, such as our salary, our work hour, our work culture, etc. And sometimes there can be catastrophic events like a life-threatening situation, which also is a very significant stressor and can turn into disorders like post-traumatic stress disorder. So let us now also understand ki how does the stress affect our body and how does our body respond to these stressors. So now stressors can be physical or psychological stressor. So the type of stressor will depend upon that which part of our body and specifically our brain is acting to counter that. Like physical stressor will mainly activate the brainstem and the hypothalamic regions, whereas the psychological stressor will activate the amygdala, hippocampus, and the prefrontal cortex. And there is a change in the neurotransmitter levels in our body. जब स्ट्रेस होता है तो देयर विल बी एक्टिवेशन ऑफ द ऑटोनॉमिक नर्वस सिस्टम, जिससे हमारे एंड देयर विल बी एक्टिवेशन ऑफ द हाइपोथैलेमिक पिट्यूटरी एक्सिस, जिससे हमारा कॉर्टिसोल एंड एपिनेफ्रिन इनके लेवल्स जो बॉडी में है दे इंक्रीज. अगेन द रिस्पॉन्स ऑफ द बॉडी विल डिपेंड अपॉन कि स्ट्रेसर एक्यूट है या chronic है. Acute stress में, as I explained, the sympathetic nervous system and the hypothalamic pituitary adrenocortical system they get activated, and जो level of cortisol and epinephrine है हमारी body में they increase during the acute state. Whereas in the chronic state, when these levels, when these neurotransmitters they are they stay elevated for a long time, then they can cause some harmful effects on our body, which we will see subsequently. So, just to understand the body's response during a stressful event, so there are different models of stress that have been described. Okay. One of them is a general adaptation syndrome, which is a three-stage process that describes the changes that a body goes through when under stress. तो इस मॉडल में स्ट्रेस फुल रिस्पॉन्स को तीन स्टेजेस में डिवाइड किया है. द स्टेज वन इज द स्टेज ऑफ अलार्म. दैट इज व्हेन वी हैव एन acute stressor, our body will respond by increasing the adrenaline and the cortisol levels, which helps mobilize the sources of energy towards dealing with that stress. जिस रिस्पॉन्स को हम एक फाइट एंड फ्लाइट रिस्पॉन्स बोलते हैं. Subsequently, two things can happen. Either the stress will go away, जिस in which case ये जो stressful जो response था phase one में हमारी body का, that will also wean off, or there can be a situation in which the stress persists for longer duration, in which the body will enter into stage two, which is the stage of resistance, in which the body will continue in which the body will continue to have these altered physiological state, and will gradually try to adapt living with the higher stress level. During this stage, a person can experience, some sort of irritability, some frustration, because the body at some level is continuously fighting with the stressor. And if this stressful period continues even further, then we reach the stage of exhaustion, in which the body no longer has the strength to fight, or the resistance is no longer possible. उस stage में जाके then we start experiencing things like fatigue, burnout, and it can precipitate illnesses like depression, anxiety, etc. So it is so this means that it is important for us to understand that where we are during that phase of experiencing the stress. Then stress, in different people, stress can manifest as in form of different ways. Like someone can have experience headache, muscle tension, or heaviness in chest, or maybe a lump in throat. And it can involve various different organs: the cardiovascular, respiratory, the GI system. Person can have diarrhea when he's stressed. They can also have constipation when they're stressed, increased perspiration, and so on. And not just physical symptoms, one may also have psychological symptoms, not symptoms but manifestations of stress, where one is not able to focus. You may get angry easily, not able to sit in one place, sleep is disturbed, you worry a lot, you feel tired all the time, there is nervousness, worries, irritability. So different people will have different manifestations of stress. Not everyone will have the same experience, and this is because everyone has a different set of factors which are acting on them. Which either are buffering or protecting them from stress, or they might also be contributory to the stress. Like what type of social support you're having, what type of economic support you're having, what has been your past experiences, what is your personality type, what are your personality traits. Then the most important thing is how what sort of a lifestyle you are living. So because everyone is having manifesting stress in a different way, so the way of coping with that also becomes different for everyone. And coping we define as a process of managing stress. There can be different types of coping, like there is approach and avoidance coping, and there is problem focused coping and emotion focused coping. uh, these are sort of self-explanatory terms, but still I'll touch upon them. Like approach coping will mean that you're trying to confront the problem, and avoidant coping will mean that you're minimizing the importance of the problem and trying to avoid it. Similarly, problem focused coping would involve that focusing on what the problem is and trying to find a solution. Okay, then in some situations, the solution might not be in your hand. So in that situations, the person turns to emotion focused coping, which can involve, some behavioral strategies like talking to a friend or going for a walk, or some people, turn to drinking or smoking, which is absolutely not recommended. Then there can be some cognitive strategies that people start to thinking about their problems in a positive way. So these are also types of coping. And mostly what is seen is that people resort to the ways of coping which are considered not exactly healthy. uh, when stressed, one you may see that one might be yelling on people around him, or their people working under them, or their family members, or they might be staying in the bed, not involving in to conversations with people, isolating themselves, or turning to alcohol, tobacco, or other drugs. But all of these might help to some degree to the person, but in general these are considered unhealthy ways of coping, and one should absolutely avoid them. On the other hand, there are some healthy ways of coping, like taking care of yourself, exercising, sleeping properly, eating properly, talking to others about your problems, taking a break, uh, during the stressful situation if that is possible. And one of the most important needs of that one needs to understand while coping with stress is one should recognize that when they need more help. That is a very important aspect of coping with stress, because if the stress is persistent, it is continuous, or you're having thoughts about harming yourself, or some other things, then it is always better to talk to a mental health professional and seek a professional help for that. So recognizing that is also very important, not just for yourself. It is also important to recognize people around you who might not be able to cope with stress which they have to deal with. So till now we have understand that stress is there, and if we are able to cope with that, well and good. But if we are not able to cope with stress and it continues to occur, there's a chronic stress which is occurring, then it can lead to some serious physical as well as mental health issues. Like in the cardiovascular system, one gets more prone to having hypertension, atherosclerosis, coronary artery disease. It affects our, chronic stress affects our immune system. Someone who's already suffering from an autoimmune disease might have flare of that disease, exacerbation of that disease during times of stress. It affects our memory, cognition, the GI system. There's a well established role of having irritable bowel syndrome associated with stress. It fastens the aging process. Stress is associated with infertility and pregnancy and other issues, and not to miss out endocrinological problems, which I think sir would be a better person to tell you about. Then it's not just limited to the physical illness. Psychiatric illness are also very common, which in which the stressor can be a contributing factor in initiation as well as in the course of the condition. One can develop or worsen the depression or bipolar affective disorder, or have anxiety disorders, eating disorder, or sleep disorders. So this was just an overview to understand that why stress is important and how it is occurring. It is also, like in the beginning of the session we said, that it is ubiquitous. Everyone experiences some stress at every point of time, and a little bit of stress should not be a problem. But it is when the stress becomes high that it starts affecting our body, and people start getting unpleasant feelings. That is the time when we need to be concerned. So when it comes to stress management, one thing I want to clear out initially only, that there is a very limited role of pharmacotherapy, that is medicines. दवाइयों से बहुत ज़्यादा हेल्प डेली रूटीन की स्ट्रेस मैनेज करने में फ़ायदा नहीं होता है, एंड medicines should be, pharmacotherapy for that matter, should be limited only when there is, severe and disabling conditions, or when we are developing disorders. And medicines should never be prescribed by self. Hamesha we should consult a mental health professional, a psychiatrist for that matter, before we are turning to medications. So in this session we'll mostly discuss on what things we can do on our own. So in stress management, one of the most important things is lifestyle changes. Okay. And multiple studies, RCTs, and meta analysis have shown that lifestyle changes have a significant impact on how we manage our stresses. Lifestyle changes would include like scheduling your day or maintaining a routine. Now, it is important because, if you are having a stressor, then uncertainty in a day will further add to the frustration. So it is always better to plan your day ahead, especially if you are involved in if you have multiple tasks that you need to perform in a day. So scheduling your day, maintaining a routine, has always shown to be much more helpful, and it reduces the stress to a great degree. Then second, very important thing is having an adequate sleep. Now, it is always recommended that one should sleep for 6 to 8 hours, have a healthy sleep. But in order to practice that, one needs to follow certain practices, what we call as the sleep hygiene. Just one need to make sure that you fix a time to get into bed, your time to sleep, and your time to wake up. You fix those times. You avoid using your mobile phone while in bed before going to sleep. Avoid watching television while in bed before going to sleep. Avoid taking any caffeine, tea, especially during the evening hours, and avoid taking any alcohol or any self-prescribed medications for that matter for sleep. And having an adequate sleep hygiene will definitely help you in having decreasing the stress. Then exercise, physical activity of any sort is helpful. It increases the release of endorphins, It maintains the it regulates the blood circulation, it regulates the breathing pattern, and it also decreases the cortisol level, which we saw initially that cortisol is something which increases when we are in a stressful situation. So there are a lot of recommendations that you will find about how much to exercise, what type of exercise, but just to put simply, any type of any amount of exercise will be contributory in managing stress. And it should be done on a regular basis, not once in a blue moon type. Then another thing for those who don't want to go turn to exercise is yoga, which is equally good. It has shown equally good results, when considered, when the studies were conducted comparing yoga to exercise. So it is equally good in reducing stress. It improves our attention, concentration, it relaxes the muscle tension, and it helps to cope with stress. Next, we come to something apart from the lifestyle changes. We come to second thing, which is progressive muscle relaxation. Now, this is a type of relaxation technique and sort of an exercise which one can easily perform on their own in their home. Uh, what it involves is that you are actively contracting your muscles to create a tension, and you progressively release this tension. Okay. Now, this progressive muscle relaxation, it requires some learning, but it is an easy to learn, technique for relaxation. And if we search on the YouTube, search progressive muscle relaxation, so you will find ample enough of resources. जिसको आप देख सकते हैं, you can learn from that. You will find videos from 3 to 4 minutes onwards and up to 40-50 minutes of guided muscle relaxation techniques, which are helpful. Performing these muscle relaxation techniques for even 15 to 20 minutes, they have shown to help a great deal in improving day-to-day stresses. And not just performing this in routine, but in situations where you're having stress. You say there's some acute stress, there's some acute thought, thought which is going on in your mind, which is disturbing you in that time. And during that time also, you can perform this exercise. It will take you hardly 10 to 15 minutes, and it tends to reduce the stress levels and helps you focus on the task at hand. Okay. Then we come to another simple technique, which is called diaphragmatic breathing, yeah, more simply called deep breathing. जिसमें you inhale slowly, you hold for a few seconds, and you exhale slowly. Okay. This technique also works very well in moments of stress, and this also has a lot of scientific basis. It increases your blood oxygen levels, it stimulates the vagus nerve, calms down your anxiety a bit, and it also helps in reducing the burnout that people experience. Then there's some more you know uh, techniques like the mindfulness based stress reduction techniques, which is based on the broader concept of mindfulness. Jisme there is the act of consciously focusing the mind in the present moment. Sometimes we get stuck in the our worrying thoughts about worries about the future, about the self. So with learning this technique can help you focus back on what you're doing in the present moment. This requires a slight learning curve, and it is better done in under the guidance of some professionals who are skillful enough to teach you these mindfulness based stress reduction techniques. Then we come to the cognitive behavioral approaches, which is a form of psychotherapy, and you will require a professional help for that. A trained psychologist would be able to deliver this type of psychotherapy that can help you. So, uh, we've learned a few coping strategies which can be employed. So, let's learn a couple of more things. Like in presence of stressor, we have already discussed that one can have variety of different symptoms. When one is dealing with these stressors, what happens is we are not able to engage in our day-to-day life. है ना? Suppose in one moment we are involved in an activity, we are in a conversation, we are doing something, and suddenly the stressful things, stressors going on in our life, our mind will divert towards that. And उस stress की वजह से will start having thoughts and feelings जिस पे it is we say कि हम hook हो जाते हैं. We get hooked by these thoughts and feelings, which make us unfocused, and which will further lead to conflicts. We'll start avoiding people, we'll become inactive, and we'll not be able to enjoy our day-to-day activities, and we feel dissatisfied. So having these thoughts and feelings which are troubling us, not helping us focus, is okay. Everyone can have that, but one should be able to refocus or unhook themselves from these feelings and then focus back on the task at hand. Okay. Now, this doing this thing, unhooking yourself from these thoughts and feelings, this is also a skill that one needs to learn in day to day life. For example, now you'll find doing these things silly, but in long run, this happens. This helps a lot. Like suppose you're drinking a tea or coffee, then what you can do is you can practice engaging fully on the activity of drinking. Okay, you can notice the smell, you can pretend that you are tasting such a thing for the first time, observe its color, focus on the process of drinking, drink slowly, notice the temperature, the sensation. So when you do this in day-to-day activities, not just related to drinking, it could be when you're reading, when you're talking to someone. So when you're doing these things in day-to-day, day-to-day life, when you're practicing how to focus on task at hand in day-to-day life, then in stressful situations, it can be very much helpful, because once you're in a stressful situation, you are getting hooked by the uh, you know uh, the distressing feeling or thought. You are able to focus back on the task at hand. So this is a skill that one can learn in their day to day life. Another technique which is mostly used when there is an intense emotional storm, you're feeling very anxious suddenly because of something and you're absolutely not able to focus on something. So in this we use a technique which is called grounding, in which one should slow down, slow your breathing, you know breathe slowly, press your feet against the floor, stretch your arms, and all these steps will help you connect with your body. Once you do this, then you have to refocus on what is around you. Okay, notice where you are, identify 5 things that you're seeing, breathe the air, notice any smells, touch your knees or the surface beneath you, and notice and feel the texture. Identify 3 or 4 things which you can hear, and acknowledge where you are, what you're doing. These steps, one can perform, especially जैसे मैंने बोला, when there is an intentional emotional storm which is there, पैनिक सॉर्ट ऑफ सिचुएशन जब हो रही है, उस सिचुएशन में again, ये जो techniques which I have explained you, these are not some things which will take away the stressor, but it will give you time to deal with the stress. Then again, कुछ techniques तो we have discussed, but there's a module which WHO has issued, in which they have, along with a few of the techniques which I have discussed here, there are a lot of other techniques which are there in the manual, and the manual is freely available. It is for everyone, and one can go through the manual and learn techniques of how to deal with stressful situations, and actually doing what matter in times of stress. It's a good module, and I think one should try. It also it does have, the, like I was telling you, ways of unhooking oneself, these grounding techniques, and these are skills that one can use when in stressful situations. So thank you, and if sir is still there, I think, if sir, do you want to add something?
थैंक यू सो मच डॉक्टर सार्थक, बहुत मजा आया सुन के। एंड आपको थैंक्स आ रहा है कृष्ण अरोड़ा जी से, अनीता जडलानी मैडम से, अली नजाकत साहब से, एंड मिस्टर अर्नव से। एंड ही सेज गुड इवनिंग सर एंड थैंक यू फॉर चूजिंग दिस टॉपिक। तो एक तो उसके लिए थैंक यू है, एंड द सेकंड थैंक यू फॉर एक्सप्लेनिंग थिंग्स इन अ सिंपल लैंग्वेज। तो हमारा टॉपिक है कोपिंग विद स्ट्रेस। एंड लाइक वी ऑलरेडी सेड, स्ट्रेस इज यूबिक्विटस. स्ट्रेस तो आएगा ही आएगा लाइफ में, कहाँ भाग के जाएंगे. मगर जब भी स्ट्रेस आपके सामने आता है, आप उससे लड़ सकते हैं, उसके साथ कोप कर सकते हैं. कभी कभी लड़ाई करेंगे, कभी कभी भाव के साथ चलेंगे. सो दैट इज ऑल्सो पार्ट एंड पार्सल ऑफ लाइफ. यू नो हाउ टू सॉर्ट ऑफ हैंडल इट, वेदर यू वांट टू फाइट बैक और यू वांट टू जस्ट को एग्जिस्ट विद इट, और यू वांट टू मिनिमाइज इट्स इम्पैक्ट. डॉक्टर शशि खरे जी गुड इवनिंग कर रहे हैं आपको. एंड डॉक्टर सार्थक, वी नोटेड कि आपने जो तरीके बताए कोपिंग विद स्ट्रेस के, उनमें से कुछ तो हैं लाइफस्टाइल रिलेटेड विच एवरीवन कैन डू. फिर कुछ एक हैं जो हम खुद कर सकते हैं विद मिनिमल ट्रेनिंग, विद मिनिमल लर्निंग. एंड देन कुछ एक हैं, एंड वी वेलकम कृष्णा बनर्जी जी, कुछ एक हैं जो आप सिर्फ ट्रेंड साइकोलॉजिस्ट या साइकाइट्रिस्ट के साथ उनकी देख रेख में ही हम कर सकते हैं. सो लेट्स स्पीक अबाउट दिस फ्रॉम अ प्रिवेंशन पर्सपेक्टिव. अब जब हम हेल्थ में बात करते हैं, तो अलग अलग लेवल्स हैं प्रिवेंशन के. प्राइमोर्डियल, प्राइमरी, सेकेंडरी, टर्शरी. वी ऑल्सो हैव क्वाटरनरी एंड क्वाइनरी प्रिवेंशन. तो प्राइमोर्डियल प्रिवेंशन हुआ जहाँ पे रिस्क फैक्टर नहीं है स्ट्रेस का, स्ट्रेस भी नहीं है, रिस्क फैक्टर भी नहीं है, वहां पे भी हम एक्शंस ले रहे हैं. अब ये तो शायद ही कोई इंसान हो दुनिया में जिसको स्ट्रेस ना होता हो. इवन कोई नवजात शिशु है, इवन अ न्यू बॉर्न बेबी, उसको भी स्ट्रेस होगा कि मेरे को दूध मिलेगा कि नहीं मिलेगा अभी 3 घंटे के बाद. तो प्राइमोर्डियल लेट्स टेक आउट. सो नाउ वी कम टू प्राइमरी प्रिवेंशन. प्राइमरी प्रिवेंशन है जहाँ पे स्ट्रेस के रिस्क फैक्टर्स हैं, विच इज ईच एंड एवरी ह्यूमन बीइंग, बट अभी तक स्ट्रेस नहीं है, क्लिनिकल स्ट्रेस नहीं है. तो ऐसे में फॉर प्राइमरी प्रिवेंशन व्हाट कैन बी प्रिस्क्राइब to each and every adult, each and every child and adolescent?
Yes. It's a very important question, and sir, मतलब I think जो what I was explaining about the lifestyle modifications, जो lifestyle changes हैं, I think आज के time में they become the most important thing that one needs to, one needs to have a healthy lifestyle, which everyone understands. And but I think there are very few people, or a good majority of people who are actually not able to practice that. But uh, the lifestyle modifications, they I think are the most important thing. And I think in today's time, not just a psychiatrist, if anyone goes to any doctor, for any illness, so lifestyle modification is something which each and every doctor will prescribe for almost every health condition. So it's, and not just for not just for an illness wali health condition, but to have a good health, have a healthy life. For that also a good lifestyle is very important, जिसमें सारा कुछ, it involves our daily routine, it involves what we are exercising, how much we are exercising, what we are eating, what we are drinking, how much of what we are consuming. ये सारी चीज़ें आ जाती हैं. तो कुछ चीज़ें जैसे आई हैव टच्ड अपॉन, कि जैसे मेंटेनिंग अ गुड स्लीप, इट इज़ अ वेरी इंपॉर्टेंट थिंग विच एवरीवन नीड्स टू डू. एंड आज की लाइफ में आई थिंक ऑलमोस्ट एवरीवन, व्हाट they do is, everyone has smartphones, everyone is on social media, and once they get home, once they are in their bed, everyone tends to just scroll through whatever social media app they're using, जिसकी वजह से जो स्लीप आ जाती बिना उसके भी, वो डिले हो जाती है. एक तरफ तो वी वांट टू स्लीप, वी पीपल से दैट हमें नींद नहीं आती तो हम इसलिए फ़ोन चलाते रहते हैं. तो एक तरफ तो वी वांट टू स्लीप, देन ऑन द अदर हैंड वी आर यूजिंग द स्मार्टफ़ोन व्हिच इज़ ट्राइंग टू एक्टिवेट आवर ब्रेन,
Hmm.
है ना? तो वो एक कॉन्फ्लिक्ट में चला जाता है फिर हमारा माइंड, कि सोना है कि जागना है. एंड उसके बाद अगर नींद आ भी जाती है, तो आई थिंक एवरी वन ऑफ अस वुड हैव एक्सपीरियंस कि नेक्स्ट डे वी डोंट फील एज फ्रेश एज वी शुड.
That's right. तो प्राइमरी प्रिवेंशन की अगर बात करें तो दिस इज फॉर एवरीवन, ऑल ऑफ अस. एंड वी एक्नॉलेज द क्वेश्चंस एंड कमेंट्स फ्रॉम म्यूजिक लवर जी, कृष्णा बनर्जी जी एंड डॉक्टर मुकेश मकरोलिया. प्राइमरी प्रिवेंशन के लिए लाइफस्टाइल मॉडिफिकेशन. एंड डॉक्टर सार्थक ने एक चीज ऐड की. नॉर्मली वी स्पीक ऑफ द स्पेशल एसेस. S for structured physical activity, S for sensible sustenance, sensible diet, S for avoiding substance abuse, sleep hygiene, and stress management. Apart from that, you might want to add an S, which is spirituality. Now, there is a lot of difference between spirituality and religiosity. Uh, आध्यात्मिकता और धार्मिकता हिंदी में, रूहानियत और मजहबियत उर्दू में. So there is a lot of difference between ruhaniyat and mazhabiyat. Even if you don't follow a particular religion, you say that you are an atheist, so that's fine. That's okay. But ruhaniyat or adhyatmikta, which is spirituality, that also helps in stress management, in coping with stress. एक और एस जो डॉक्टर साहब ने आज जोड़ा है, एंड एस इज फॉर सार्थक, वैसे तो एस हैपेंस टू बी फॉर संजय आल्सो, दैट इज फॉर स्मार्टफोन यूजेज और स्मार्ट सोशल मीडिया यूजेज. तो डॉक्टर सार्थक ने ये तो नहीं कहा कि सोशल मीडिया बिल्कुल भी ना इस्तेमाल करें, ही जस्ट सेज कि लेट नाइट ना करें. यही रूल्स डाइट और एक्सरसाइज के भी तो हैं. इफ यू वांट टू डू एग्रेसिव और विगरस एक्सरसाइज, मे बी लेट नाइट वुड नॉट बी द गुड आइडिया, बिकॉज योर सिंपैथेटिक टोन विल गो अप, यू वोंट बी एबल टू स्लीप. आपने खाना खाना है, कोशिश करें कि डिनर और सोने में 2-3 घंटे का गैप हो. तो ऐसे ही जैसे आप डाइट और विगरस एक्सरसाइज में और सोने के टाइम में, नींद की बेला में आप 2-3 घंटे का गैप रखेंगे, तो स्मार्टफोन यूजेज या सोशल मीडिया यूजेज में गैप रखने की कोशिश करें. नाउ वी कम टू सेकेंडरी प्रिवेंशन. सो लेट अस से स्ट्रेस हुआ या जो भी बायोलॉजिकल मैकेनिज्म्स थे हमारे ब्रेन में, हमारी नर्व्स में इम्बैलेंस हो गया केमिकल्स का, उसकी वजह से वी गेट अ डिजीज मे बी लाइक मेजर डिप्रेसिव डिसऑर्डर और एंजाइटी. सो नाउ लेट्स टेक ऑल दीज थिंग्स टुगेदर. म्यूजिक लवर जी कहते हैं कि सर आई एम टेकिंग एम्पॉज टैबलेट ड्यू टू एंजाइटी प्रॉब्लम. इज इट सेफ टू टेक दिस मेडिसिन और कैन देयर बी साइड इफेक्ट्स? एंड डॉक्टर मुकेश पूछते हैं विच न्यू एसएसआरआई ड्रग्स आर यूजफुल in the long term management of stress, though maybe what he means is in the long term management of depression, not in the long term management of stress. So Dr. Sarthak, secondary prevention means disease aa gayi hai, it's a clinical disease and we have to do early diagnosis and early management. So how can we diagnose clinically significant psychiatric disorders like anxiety or major depressive disorder? How can we diagnose them, screen them in a timely manner? Vinayak Sharma ji ne bhi join kiya hai. And once we have diagnosed them, what are the basic rules for treatment? Once we answer those, automatically Dr. Mukesh's and Music Lover ji's answers, questions will be answered.
Yes. So, जब भी whenever we are experiencing stress, one way is that सबके अपने different coping strategies होते हैं, coping mechanisms होते हैं. Then we have discussed some few things which we can do by ourselves, lifestyle modification, dietary modifications, etc. It is important to recognize that even if जब हम जो अपने लेवल पे कर सकते हैं चीज़ें जो हमने अभी डिस्कस की हैं, when जब हमने वो चीज़ें कर ली हैं उसके बाद भी if we are getting affected by the stressor or we our health is getting affected, even if we are trying to maintain a good sleep hygiene but हम नहीं कर पा रहे, we are trying to work out but still we are not able to focus on our work, we are not able to concentrate, we are not able to eat properly, यानी हम चाहते हैं कि हम खा लें बट इच्छा ही भूख ही नहीं लग रही है, लॉस ऑफ एपेटाइट हो गया है, sleep disturbance ज़्यादा prominent हो गया है. Then if we're starting having thoughts जिसमें हम we start feeling that we are not good enough और we start worrying excessively about the future कि मुझे नहीं पता आगे क्या होगा, आगे कैसे होगा. जब ये चीज़ें एक लिमिट से एक्सीड होने लग जाएं, when you think that even जितना भी आपने कोशिश कर लिया उसके बाद भी अगर आप नहीं हैंडल कर पा रहे हो, तो I think that would be the right time to seek professional help. It's not just about oneself. When we see people around us, हमारे आसपास जो लोग हैं उन लोगों में भी if we are seeing someone who's not interacting as well as he used to और जिसके performance में एकदम से decline हो गया है at work और who suddenly has become very irregular at work या irritability levels बहुत ज़्यादा बढ़ गए हैं, तो even we can advise them or help them or ask them to seek help, professional help.
That's a good answer. And then अगर इसका question ले, SSRI, Dr. Mukesh का question है. So what does SSRI mean and can we break it down into the different parts?
Yes. So SSRIs, they are a group of drugs जिसका full form होता है selective serotonin reuptake inhibitor. तो सेरोटोनिन इज़ अ न्यूरोट्रांसमीटर जो हमारे ब्रेन में बहुत वाइड स्प्रेड प्रेजेंट होता है, एंड सेरोटोनिन इज समथिंग which has been implicated to a great extent in developing illness like depression and anxiety as well. ठीक है। तो सेरोटोनिन के लेवल्स जो हैं वो हमारे ब्रेन में इट हैज़ बीन कंसिडर्ड दैट कि जब इलनेस होती है, मेंटल इलनेस स्पेसिफिकली स्पेशली डिप्रेशन एंड एंजाइटी डिसऑर्डर्स, तो उसमें सेरोटोनिन के लेवल्स जो हैं वो ऑल्टर हो जाते हैं। तो वो सेरोटोनिन का जो इम्बैलेंस ब्रेन में हो गया उसको वापस बैलेंस में लाने के लिए देयर आर सम ड्रग्स जो कि उसके लेवल को ऑल्टर करते हैं। वन ऑफ द कैटेगरी ऑफ ड्रग्स एंड मोस्ट वाइडली यूज्ड, वन ऑफ द मोस्ट वाइडली यूज्ड ड्रग्स फॉर दैट मैटर इज व्हाट वी कॉल एसएसआरआई। वो एक ग्रुप ऑफ ड्रग्स है। देन उसमें बहुत अलग अलग टाइप के ड्रग्स होते हैं, जैसे एसिटालोप्राम, फ्लुओक्सिटिन, फ्लुवोक्सामिन एंड सो ऑन। तो अब द क्वेश्चन आई थिंक वाज दैट व्हिच इज द बेस्ट SSRI.
Safest, safest, yeah.
So yeah, so safest SSRI in that sense is matlab, when we are prescribing SSRI, it's no there is no guideline which says कि कौन सा SSRI specifically देना है. Okay, it needs to be tailored because even though हर SSRI का काम broadly is to improve depression or anxiety, but हर SSRI का कुछ एडिशनल प्रॉपर्टी होता है. सम विल हैव एडिशनल इफेक्ट ऑन स्लीप, some will have additional effect of anxiety, some will have additional effect on something else, so on and so forth. So when a patient comes to us, when we talk, सब लोग कहते हैं कि साइकाइट्रिस्ट बहुत डिटेल में पेशेंट से बात करते हैं, बहुत हिस्ट्री लेते हैं. तो this is the purpose of that. We understand the person, we understand the illness, and we tailor the treatment as per the person's need. It is not necessary कि first time when a patient will reach us, we'll definitely start him on some drugs. You know, sometimes a mild illness can be treated even with non-pharmacological management like psychotherapy. जैसे stress के लिए specifically I talked about CBT for stress. ऐसी CBT cognitive behavioral therapy for depression होता है, for anxiety होता है. तो it will be difficult to give you one drug as an answer, but in routine practice it is more of a tailored approach that we go for.
For those of us in general practice, it would be good idea to learn just one or two drugs. Maybe citalopram is a relatively easier one to use, and उसी को बार बार यूज करें. जब आप यूज करेंगे ज़्यादा नंबर ऑफ पेशेंट्स में ज़्यादा लंबी देर के लिए, तो आपको साइड इफेक्ट्स भी पता चल जाएंगे. ये एक हम्बल रिक्वेस्ट होगी टू ऑल डॉक्टर्स हु आर लॉग्ड इन. डू नॉट यूज एनी मेडिसिन विदाउट रीडिंग द प्रिस्क्राइबिंग इन्फॉर्मेशन. चाहे मेटफॉर्मिन हो, चाहे एस्पिरिन हो. And Dr. Sarthak, a salam for you from Kabul in Afghanistan. Dr. Noor Aga Danish आपको सलाम भेज रहे हैं. So use whatever drugs are available in the formulary. Read the prescribing information, and as you become more and more experienced with them, you will realize their strengths and their limitations as well. In case you feel that in your group of patients the limitations and adverse events are not acceptable, then you find another drug also within the same class of drugs, like Dr. Sarthak has mentioned. डॉक्टर साहब ने सेरोटोनिन की बात की, एंड ही सेड दैट सेरोटोनिन इज प्रेजेंट इन हाई लेवल्स इन द ब्रेन. डिप्रेशन एंजाइटी में क्या होता है कि केमिकल इम्बैलेंस होता है. सो इट्स नॉट द पर्सन's फॉल्ट, इट्स द फॉल्ट ऑफ द केमिकल्स. एंड अगर हम केमिकल्स को वापस बैलेंस कर दें तो फिर गाड़ी ठीक चल पड़ती है. अरुणा त्यागी जी ने भी लॉग इन किया है, एंड कृष्णा बनर्जी पॉइंट आउट करती हैं कि जो सेरोटोनिन है दैट इज ऑफ कोर्स प्रोड्यूस्ड इन द ब्रेन, बट इट इज आल्सो प्रोड्यूस्ड इन द गट फ्रॉम आवर गट bacteria, from the friendly bacteria. And Banerjee ji point out करते हैं that chronic stress causes dysbiosis. That means it alters the gut flora, and this is also one of the main causes of impaired gut-brain axis and gut-endocrine axis. So gut को actually हम second brain of the body भी कहते हैं, second endocrine system of the body भी कहते हैं. बल्कि sometimes a patient comes to and says कि जी मेरी गैस मेरे दिमाग को चढ़ रही है, या मेरी पेट में तितलियां फड़फड़ा रही हैं, या तोता चल रहा है, या पंखा चल रहा है. So sometimes you feel the patient is just speaking off the top of her head, but actually what she is telling you is that her gut brain axis or gut endocrine axis is impaired. It might be palpitations. Pankha chalta is usually palpitation. Then you think of pheochromocytoma, you think of atrial fibrillation, but otherwise these are all symptoms that there is an impaired gut brain axis. So, Dr. Sarthak, this last question coming from the audience, that is कि जब हम खाना पीना खाते हैं तो उससे हमारे gut microbiome को भी खाना पीना मिलता है क्या? How can we keep our gut bacteria happy so that our brain can remain happy?
सो खाना पीना, जो गट माइक्रोब्स हैं हमारे, दे आर, इट्स लाइक अ सिम्बायोटिक रिलेशनशिप इनसाइड आवर गट. तो इट्स द गट माइक्रोबायोटा जो है हमारा, वो खाने से रिप्लेनिश भी होता है. एंड जो गट माइक्रोब्स होते हैं, द दे हेल्प इन मेंटेनिंग द गट इन अ हेल्दी मैनर. ठीक है. सो व्हेन वी टेक फूड स्टफ लाइक कर्ड, तो उससे हमारे जो गट माइक्रोबायोटा हैं वो रिप्लेनिश होते हैं. इवन आजकल देयर वाज, आई थिंक कपल ऑफ वीक बैक्स एक टॉक भी हुआ था इसमें गट माइक्रोबायोटा पे, आई थिंक इसी चैनल पे. एंड उसमें काफ़ी डिटेल में इस चीज़ को एलैबोरेट किया गया.
That was by Dr. Nikhil Nagpal. तो अगर आप बेसिक रूल्स फॉलो करेंगे लाइफस्टाइल के, जैसे डॉक्टर सार्थक ने कहा है, इन जनरल आपका ब्रेन भी ठीक रहेगा एंड यू विल बी एबल टू कोप विद स्ट्रेस. ऑफ कोर्स डॉक्टर नूरागा, अर्ना त्यागी जी, एवरीवन विल से कि स्ट्रेस भी अजीब तरह की है. इट्स अ वेरी स्लिपरी ईल टू कैच. बड़ी फिसलाऊ बाम मछली है ये. तो एज के साथ भी जैसे बढ़ते जाते हैं, देयर आर न्यूअर एंड न्यूअर टाइप्स ऑफ स्ट्रेस दैट यू फेस. बट देन if your basics are strong, if your fundas are strong, your fundamentals are strong, you will be able to cope with each and everything that life throws your way. We have Batul with us backstage. Batul takes care of us and all our technical logistic requirements. Batul, आपने कुछ आज न्यू सीखा डॉक्टर सार्थक कुकरेजा से?
सर बहुत कुछ न्यू सीखा एंड आई वुड लाइक टू थैंक यू कि ये टॉपिक चूज़ करने के लिए, बिकॉज मंडी ब्लूज़ के साथ ये टॉपिक बहुत ज़्यादा हैंड इन हैंड गया. तो थैंक यू सो मच, क्योंकि हमें बहुत ज़रूरत होती है कि हाउ टू कोप अप स्ट्रेस एंड इन आवर डेली लाइफ्स. बट सर एक सवाल है मेरा, लाइक आपने इंटरपर्सनल रिलेशनशिप के बारे में बात की. तो लोगों का ये कहना होता है कि इफ़ यू स्पेंड टाइम विथ योर ओन सेल्फ, देन ऑब्वियसली यू कैन कोप अप विथ योर ओन स्ट्रेस रादर देन ट्राइंग टू फाइंड सॉल्यूशंस आउटसाइड इन द आउटर वर्ल्ड. सो इसके लिए क्या टिप्स हैं, किस तरीके से लोग अपने इंटरपर्सनल रिलेशन को और स्ट्रॉन्ग बना सकते हैं, या अपने अंदर अपने इंट्रोस्पेक्शन से वो अपने लिए आंसर्स ढूंढ सकते हैं जिससे उनको स्ट्रेस कोप अप करने में आसानी हो?
सी इंटरपर्सनल जो रिलेशंस होते हैं, दैट मीन्स कि हमारा रिलेशन विद आवर फैमिली मेम्बर्स, विद आवर स्पाउस, पार्टनर, एंड इवन विद क्लोज नेट ग्रुप ऑफ पीपल. सो द मोस्ट इम्पॉर्टेंट थिंग विद इम्प्रूविंग दैट रिलेशन इज अ गुड कम्युनिकेशन और अ हेल्दी कम्युनिकेशन. व्हेन वी आर एबल टू कम्युनिकेट, जब हम अच्छे से अपना मन की बात जो है कम्युनिकेट कर पाते हैं हमारे आसपास के लोगों से, ठीक है ना, एंड जब वो रेसिप्रोकेट होता है, दैट इज आई थिंक वन ऑफ द मोस्ट इम्पॉर्टेंट थिंग्स टू हैव अ गुड एंड हेल्दी रिलेशनशिप.
थैंक यू सो मच.
Reciprocal, yeah, a reciprocal respect also. And certainly you will be able to find people in your immediate family, in the extended family, or amongst friends, colleagues, जो reciprocate करेंगे और आपका ख्याल रखेंगे.
थैंक यू सो मच सर, थैंक यू.
एक ऑडियंस से क्वेश्चन आ रहा है डॉक्टर सार्थक, बिफोर वी थैंक यू. वो ये आ रहा है कि आपने कोई वो सिंगल पर्सन ढूंढ ली है लाइफ में जो रेसिप्रोकेट करेंगे आपकी लव और अफेक्शन और रिस्पेक्ट?
I would choose not to answer it here, sir.
So with this we'd like to thank Dr. Sarthak. Dr. Sarthak, शुक्रिया, धन्यवाद, मेहरबानी. बहुत बहुत शुक्रिया for being with us and for making such a complex topic simple for us.
Thank you
हरियाणवी
so
में
much.
there is no word for thank you actually. तो हमारी तरफ से होगा थारा भला हो. That is the closest that we are able to come to a thank you in our language. Thara bhala ho, Dr. Sarthak. Sabka bhala ho, everyone who has logged in to us today from India, Afghanistan, and other countries. And Jai Hind.